Hi everyone, my name is Emily Rios and I will be demonstrating for you a advanced and comprehensive neurological exam. I have been a neuro ICU nurse for the past 9 years, so I really wanted to learn a more in-depth neurological exam that I have seen nurse practitioners do at the bedside in my practice. The difference between an exam that I would perform and what the nurse practitioner would perform is that as the RN, I already know the injury and the deficits to expect to see. So when I perform a bedside exam, it is much more quick and focused. The nurse practitioner going in on admission does not know very much about the mechanism of injury, what trauma occurred, and what deficits to see. So they have to do very in-depth cranial nerve assessments, deep tendon reflex assessments, a mental status assessment, and sensory assessments. So for this, you will need a pen light, cotton swabs, something for the patient to smell, such as coffee, a Snellen eye chart, a reflex hammer, and a tuning fork. I do not have the last two, the tuning fork and the reflex hammer, so I will be discussing those towards the end of the video. This patient scenario is based on the one in Shadow Health, where the patient came in complaining of a headache and neck pain due to a rear end collision. So going into the room, I have obtained their vital signs. Of note, the blood pressure was elevated at 139/87. That could be due to pain and anxiety. Also, while I'm interviewing the patient to discover the chief complaint, I am always keeping in back of my mind possible neurological deficits that I may see due to the mechanism of injury. So they may have a vertebral artery dissection, which could cause a stroke. So I'm looking for stroke symptoms. I'm asking pertinent negatives related to intracranial bleeding that could happen if they were to hit their head or have a very severe concussion, such as a coup contre coup, where you hit the front and the back of your head when you have had whiplash being rear-ended in a vehicle. So let's get started. Good afternoon, Mr. Rios. What brings you in today?
Last week I was shopping for my wife, and in the parking lot someone rear-ended me, and ever since then I've been having a lot of headaches and real stiff neck.
I'm sorry to hear that. How long ago was that accident?
I want to say about 8 days ago, 7-8 days ago, 1 week.
Okay. And when did the pain start?
About 2 days after that.
Okay. Can you describe the pain in your head?
It's just like a real bad headache, and my neck is really stiff. It's like so stiff that I can't even turn it when I'm driving or even when I'm in the shower.
Okay. Is the pain in your head dull, sharp?
Dull.
Okay. And where in your head does it hurt?
It's like a headache. It's just like tight.
Sure. And on a scale 1 to 10, 10's the worst pain, what would you rate it at its worst?
6 or 7, fluctuating.
Okay. And does the pain radiate anywhere?
No, I mean, it doesn't radiate, but my neck hurts with it, so I don't know if it's like...
And what makes it feel better or worse?
When I lay down, when I'm getting ready for bed, it kind of relieves it a little bit, and my wife gave me some headache pills, maybe Advil or something like that, I'm not sure. I took 2 of them, and that relieved it for a little bit, and then that's about it, but it came right back.
Okay. How many times a day do you take the Advil?
One in the morning and one at night.
Okay. Anything else that you've tried to relieve the pain?
No, except just the laying down at night. It relieves it just a tad. It's the only thing I really notice.
Okay.
So sometimes I'll try to lay down real quick.
And when you're straining or sneezing, have you noticed any increased pain in your head? Okay. Do you know if you hit your head during the accident?
No, I didn't hit it.
Okay. So I'm going to ask you some questions to test your memory and your thinking. So they might seem a little silly, but just bear with me. Okay. Where are you right now?
In a hospital.
Okay. And what's the month and year?
August 2022.
Okay. And why are you here?
To see about the headache and my stiff neck from a car accident.
Okay. Does a stone float on water?
No.
ocean and a lake alike?
They're both water.
Okay. Can you repeat these 4 words to remember for later?
Okay.
Coffee, rose, ear, bus.
Okay.
Okay.
Coffee, rose, ear, bus.
Okay. Can you count backwards from 100 by sevens?
Okay.
You don't have to do that. You done. That was great.
Thank you.
Let's see what else. Who was the first president of the United States?
George Washington.
Okay. And what did you do for your last birthday celebration?
I had dinner with my family.
Okay. And can you repeat those 4 words back to me that I just told you?
Rose, coffee, ear, and bus.
Yes. Okay, great. Okay. I'm going to ask you about any other symptoms that you may be having. Have you had any new blurry or double vision?
No.
Any sensitivity to light?
No.
Which may occur with migraines. Any changes in your voice or speaking?
No.
Have you had any nausea or vomiting?
No.
Have you felt off balance?
No.
Which would be a possible bleed in your cerebellum if that were the case. Any problem swallowing?
No.
Any new numbness or tingling?
No.
Okay. Any changes in your hearing?
No.
Any weakness in your arms or legs?
No.
Are you experiencing unusual fatigue?
No.
Any new problems sleeping?
No.
Next, I will be doing a physical exam to test your cranial nerves. Okay. Can you shut your eyes really tight? Open them really wide like you're surprised. Can you blow your cheeks out like a fish? Okay. And show me your teeth, big smile. Great. Looking for a droop. That looks equal. Stick out your tongue and go side to side with it, up and down. Great. Okay. I'm gonna see about your hearing. Can you hear this? Can you hear this?
Yes.
Okay. Can you raise your arms up like you're carrying a big tray and close your eyes for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm looking for a pronator drift. I don't see one. Can you give me a big squeeze and pull me into you? Oops, sorry. Push me away. Okay. And with your legs, can you raise this one for 5, 4, 3, 2, 1, and resist me? Good, and resist me again. Raise this one for 5, 4, 3, 2, 1, resist me. Good, and resist me. Okay. Now I'm going to check your sensation. Okay. Does it feel the same on both sides? Same on both sides? Same? Okay.
Feel the same?
Okay. Any numbness in your feet that you notice?
No.
Okay. Next, I'm going to test your finer sensations. So I'm gonna kind of poke you with the swab. You're gonna tell me if it feels dull, soft, or sharp. Okay, and close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Sharp.
Okay, great. Next, I'm going to check your pupil reaction. So I'm going to shine this bright light in your eye. Just look at my nose. So as I'm doing this, I'm looking for perla, which is pupils are equal, round, reactive to light, and they should both be doing the same thing. When I shine the light in this eye, this should be reacting the same, and vice versa. So now I'm going to check your extraocular movements. So you're going to follow this with your eyes, just your eyes. Okay. So with that, I'm looking for nystagmus. When the eyes move sideways, it would be kind of like a jittering movement up and down. You would see the same thing. I'm also looking for any slowness in one eye to move side to side, which would be a dysconjugate gaze or a palsy in one of the cranial nerves. Okay. Next, I want to, I would check your gag reflex. I'm not going to do that. I'm going to check your visual acuity. So I have this Snellen eye chart that's 20 feet away. So I'm going to have you stand. And I'm going to have you cover one of your eyes with your hand, and you're going to read each line at a time, and you're going to stop when you can't see anymore.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P. That's about as good as I can get, Doc.
Okay. So that is about a 20/30. That's the last line that you can read. And then we would repeat that for the next eye. Okay. The next tests that I would want to perform are the Weber and Renee tests for hearing, but I don't have any of those tools, so I will be discussing those later. Next, I'm going to test the rapid alternating movement, which is a test of your cerebellar functioning. So I'm going to have you close your eyes, and you're going to touch your finger to your nose with each hand. Okay. Next, I'm going to have you flip your hands backward, supine and pronate them on your legs. Great. Okay. And then the last thing I want to see is your gait or your walking to see if it's off balance or unsteady. So I'll have you walk to the door and back. Okay, great. You can have a seat. At this point, I would have liked to test cranial nerve 8 with the Renee and Weber test with the tuning fork to check for conductive hearing loss. Another neurological exam that would be needed is the deep tendon reflexes with the reflex hammer to check for any spinal cord deficits. Deep tendon reflexes are graded 0 to 4. 0 is no response and 4 is clonus. Other sensory tests would be graphesthesia, where you trace an A or an 8 in the palm of their hand and you ask them to tell you what you wrote. This would test for lesions in the brainstem, spinal cord, and thalamus. You would also put common objects in their hand and ask them to identify it within 2 to 3 seconds, 90% of the time. That's the stereognosis test. So I'm not really seeing anything acutely neurologically abnormal. What I would recommend is taking an ibuprofen, which is Motrin, 800 milligrams every 8 hours for the next 2 weeks. I'm doing some gentle neck stretches, which I'll print out some education for you to read and do. And also trying some heat pads and some ice packs if that helps. If your pain is not relieved in the next week, I do want you to call us back, and we will have to maybe do an MRI or a CT scan to see what's going on.
Okay.
All right. And that is it, and I hope you feel better soon.
Thank you.
All right. Another important piece of patient education to include is teaching on the stroke symptoms using the FAST acronym, which stands for face, arm, speech, time, and just telling them that any of these symptoms could mean a stroke, which is an emergency that can be quickly treated in a timely manner if they treat it as such. Here are my references. Thank you for viewing my video.